In hospitals, a treatment will normally start with extra oxygen supplied through a nasal cannula and therapy to combat dehydration. Patients have typically had a fever for days and not been drinking enough.
This treatment will normally start with...
Treatment will start. Okay, that's the main sentence.
The treatment will start.
That's the main sentence.
And
okay, fine. And okay, no. That's it. Treatment will start. Okay, so we'll start with what?
With the
extra oxygen and what else?
With the extra oxygen supplied. And this is a nasal,
and therapy.
Nasal cannula.
Don't worry about that. I want the main sentence again. So let's look. You start with what? Oxygen supply.
Start with the oxygen supply and
therapy.
Therapy
to combat dehydration. Therapy, right? Extra oxygen for what? How do they do that? Extra oxygen.
They put a machine.
No, they put a nasal cannula, a nasal tube.
A nasal tube.
I'll tell you what cannula is. A plastic tube with a prong for each nostril. So it's like this. It's a plastic tube with like a fork for the nose. You put inside the nose.
Oh, nose.
Prong. Prong is like a fork.
Fork? What fork mean?
Fork? Knife, fork, hamburger. Fork.
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 What with a hamburger?
Didn't they use a fork yesterday to cut a hamburger?
Okay, so what's nasal? It's type of tube, right?
It says there, plastic tube with a prong for each nostril.
Okay. And
therapy to combat dehydration. Dehydration means lack of water. D means not in. D means opposite. D means opposite. Hydration means water. Hide means water. Hydra means water. So dehydration means without water, or because people with COVID typically are dehydrated. They don't have enough water.
Okay.
So patients typically have a fever.
Wait. So therapy to combat is the way to make more water.
Therapy means just therapy is like a treatment.
A treatment to combat.
Yeah, to fight the dehydration.
Or fight the lack of water.
Yeah.
Patients have.
Well, they tell you why. So this colon here means why they have lack of water, because they have been having a fever for days and not been drinking enough, leaving their bodies badly short of fluids. So rest. So now the next sentence: rest, rehydration, and extra oxygen, along with drugs for any secondary infections that have taken advantage of the body's stressed out state, give the immune system a chance to get the upper hand. What's the main sentence here?
So there's rehydration.
Rest, rehydration,
and extra oxygen.
Yes.
These two.
These three things.
Three?
Yes.
This?
Rest, rehydration, extra oxygen. Three things.
Rest, rehydration, and extra oxygen give the
that's right. That's the main sentence.
A chance to get
okay, fine. So these three things give who? Immune system what?
A chance.
A chance to get the upper hand. Upper hand means top of the hand. Upper hand.
Yeah.
Means that you're winning. So if you play a game, you like hit like the top of the hand. So top of the hand is the one that's winning, right? So give immune system the upper hand. They can win.
Help the immune system work again.
To win.
To win. Okay. So how? By
not how. This is these three things along with means also with drugs.
With drugs.
For any secondary infections that have taken advantage of the body's stressed out state. So this is called secondary infections. It means like besides COVID, because your body is already weak.
Yeah.
Just because your body is weak just because you have one disease doesn't mean you cannot have two diseases. You can have 2, 3, 4 diseases at the same time because your body is weak. So you can still get a cold, for example. You can get other flus. You can get bacteria, right?
Okay.
You can get a lot of other bad stuff happening to you if your body is weak.
Yeah.
So that's just because you have one disease does not mean your body cannot have other disease.
So this is secondary infection.
So this secondary infection. So they also give drugs to help fight any secondary infections.
But secondary infection is because of the COVID-19 or
No,
other?
secondary infection is because your body is weak.
But still, it's the virus to hit the weak body.
Any other virus. COVID is one. When your body is weak, it can be any other virus. That's why it's secondary infection.
Okay.
Other stuff, other virus, other bacteria, other fungus, whatever can attack you.
Okay. So actual oxygen, I know you need more
Yes.
oxygen. But this rehydration.
Okay, we had dehydration. What do you think rehydration means?
Where's dehydration?
Oh my gosh, just look above. We just talk about dehydration.
Above.
Dehydration, combat dehydration.
Oh, this the lack of water.
Yes, what do you think rehydration means then?
Much more water?
No, re means again, right? Redo something again, more.
Oh.
So you again put water back. That's rehydration.
Okay, put water back.
Because dehydration means you took the water out.
Yeah.
So rehydration means you put the water back in.
Oh, okay. So what the rest? Exact these two.
Rest is to sleep, to take easy, not do anything stressful. That's rest. What are you talking about?
What?
Rest.
Okay.
Go to rest. Restroom. You know restroom? Bathroom? Rest.
But you say the three things give the immune system
Yes. So what?
a chance.
Yes.
Give more oxygen, make it more water, and have a rest. Give the immune system a chance to get up again.
Yes.
Okay, understand. Thank you.